Hello lovely people, thanks for joining me on another episode set out to best educate you. It's Let's Talk Health once more, and today's focus is on hypertension, also known as high blood pressure. It's a serious medical condition. Do you know that one could have high blood pressure and you won't have any symptoms for years? Well, you said that's scary, but don't worry. The doctor I have in the house today, my guest, is going to enlighten us on everything we need to know. But before we begin, before we get to the business of the day, let's go on this short break. I'll be right back. Welcome back. If you're just joining us, the program is Let's Talk Health. And the topic for today is hypertension, otherwise known as high blood pressure. Today on the show, I have a special guest to treat the topic with me and, of course, enlighten you. Stay tuned as he joins me. Okay, if you're just joining us, the program is Let's Talk Health and it's the interview segment. And I have with me in the house Dr. Richard Ogbimi. He's a general practitioner and he's going to be telling us everything we need to know about high blood pressure, hypertension, like I told you earlier. Thank you for joining me on the show this morning.
Thank you for having me.
Yeah. Yes. So, first of all, I know our viewers want to know, I want you to explain in detail what high blood pressure is.
Okay, high blood pressure, usually a layman term.
Okay.
The medical term is hypertension. Yes. Hypertension is a very difficult disease condition to define definitively because it depends on the environment and the lifestyle of people.
Yeah.
So, but however, hypertension is when you have an elevated blood pressure.
Okay.
Meaning that there are certain numbers and parameters we use to assess hypertension. So we call them systolic and diastolic.
Okay.
So when the blood pressure is high, that's what's called hypertension. But to medically define it, hypertension is when you have blood pressure of 140/90 taken on two separate occasions 4 hours apart.
Okay. So we're going to come to that figure later.
Okay.
But for now, I want to know what causes it. What are those, is it, let's say, lifestyle or habits? What can really prompt the condition, the ailment?
Yeah, the causes of hypertension can be divided into two actually.
Okay.
Yes, first we have the primary or essential hypertension, then we have the secondary hypertension. Under the primary hypertension, the causes are usually unknown, and that's responsible for about 95% of hypertension.
Okay.
So in 95% of cases, the causes of hypertension is unknown, idiopathic. But in the other 5% or less, the causes are known. So part of the causes that we know are alcohol.
Okay.
Alcohol ingestion causes it. I know it's something good. Alcohol causes hypertension. Okay. Obesity. You can have.
I know about obesity.
Yeah, obesity. Yes. You can have smoking. Smoking is very, very bad for hypertension. Once you have to even quit smoking.
Really?
If you do, yes. Smoking and also endocrine diseases like when I say endocrine, I mean things like there are a lot of medical terms, but pheochromocytoma.
Okay.
It's like a tumor of the adrenal glands. We have kidney diseases, chronic kidney diseases, and we have use of oral contraceptive pills. That's OCPs. The women use it sometimes to prevent
pregnancy.
Yes,
that's a whole lot of causes, if you ask me.
Yeah, there are a lot. They are quite numerous, actually.
Okay. Now let's go down to the symptoms, because I read up somewhere that you can have this hypertension for as long as years without having any symptoms, so you won't even know that anything is wrong.
Yeah, that's true.
How do we get to know?
It's as it is. In symptoms of hypertension, as you said, are usually unknown to people.
Okay.
So that's why hypertension is actually called a silent killer. So, but however, people present with symptoms like headaches.
Okay.
Yes, they could have visual disturbances, maybe problems with their sight and view. They might not just complain, "Oh, doctor, I can't see well." Okay. So a layman would just probably think it's something that doesn't have to do with blood pressure.
Yes.
But actually, that's
of
a very
one
big sign.
Even think of it.
Yeah, it's a very, very big pointer to hypertension. So those are the main things, symptoms. There are other signs that for the doctors, because we are the ones that elicit the signs. But symptoms for people to understand, the most common are headaches and visual disturbances.
Okay. Is it in every case of headache and visual disturbance? No, I bet it's not in every case.
No,
Because
definitely
I could have a
not.
headache now, and then I have, okay, for me, I'm short-sighted. But I say, okay, I'm prone to hypertension. It's not in every case, obviously.
But you will have to be examined by
I have
any
to be
normal or
examined.
any good doctor will check your blood pressure if you complain of headaches.
Okay. So what are the chances of one getting this ailment?
It's the chances are actually high considering our lifestyle now in Nigeria.
Yeah.
Yes, people eat. Well, we have acquired the Western kind of culture now, and so we tend to eat burgers, chicken, all those things. So
Okay.
it's high actually.
Okay, very high. So how can people get to prevent this? Because you just mentioned lifestyle, and it's something that even though most people they know, but they tend to look away from things that you tell them this can cause this, but they tend to ignore it.
Yes.
So what can one really do now to prevent, apart from the things I eat, apart from my life, okay, apart from the things I take in, let me put it that way, what other things can one do to prevent?
Apart from diets,
Yeah.
and I think that's what you mean. There are certain things you need to do to make sure you prevent hypertension,
Okay.
because sometimes our blood pressure tends to elevate as we age. So
Okay.
it's something that might be inevitable in the long run.
Okay.
However, things like weight reduction, it has been shown that
Oh, really?
yes, blood pressure can reduce. Okay, I will explain the numbers later,
Okay.
but it reduces the blood pressure. Well,
Okay.
yes. So if you can engage in exercises like aerobic exercises,
Mm.
not just lifting of heavy weight and all that,
Okay.
it will help. But aerobics are very important.
Okay.
You need aerobics as well.
Aerobics, eh?
Yes,
That's
yes.
a good one. Okay, now coming to who are those prone to have this hypertension? Are children prone to having it?
Yes, children can have
Children of what age?
They can. It depends. Some children can be born with some heart conditions. So an
Okay.
example is congenital heart disease.
Okay.
Yes, some people can have ventricular septal defects. There are
What's that?
some heart problems. That's
Okay,
when the
heart
heart, the heart has 4 chambers
Yeah.
and is divided by septums.
Okay.
So when that septum there's a defect in the septum, there will be abnormal flow of blood.
Okay.
Instead of the blood to flow in a certain way to now
Okay.
start mixing up.
Okay.
So that's already a heart problem.
Okay.
So that one can can complicate hypertension as well.
Okay.
Yes, there may be children that are taking steroids. Some
Okay.
people are actually exposed when parents don't keep some drugs well.
Yeah.
Children take all those things and it can cause
Can
hypertension
predispose
as
them.
well. Yeah.
Okay. Now there's one thing that I wanted to ask. What really causes hypertension in pregnancy? Most
Hypertension.
times you see pregnant women, they say their blood pressure is up. What really
Yes,
happens?
they could have it. Number one is stress.
Okay.
Then there are lots of hormones women secrete during pregnancy.
Pregnancy,
We have
okay.
estrogen, progesterone, they're all steroids. I told you earlier on, steroids is part of the things that could also cause hypertension.
Yeah.
And also lifestyle. Some people eat very wrongly, and some women tend to eat more when they're pregnant. So they just eat everything,
Anything.
take chicken skin, everything, just like that. So it's also a
Okay.
problem. Then drinking. Some women still drink when they're pregnant.
Yeah.
Despite the risks involved in drinking
Mhm.
during pregnancy. So those are things that could
Cause
actually lead to it.
pregnancy.
And there are different types. You have the pregnancy-induced hypertension. There's also pre-eclampsia and then eclampsia. But that was a very detailed stuff. If I want to
Okay.
go into it now, it's going to be very extensive.
Okay. So is there any tests that one can do to detect this ailments earlier before it gets out of hand?
The best, would I call it a test, is actually more of an examination. Is
Examination,
to
okay.
check the blood pressure. That's
Okay,
the best.
that's just it.
Yes, but when you go to the hospital for tests, laboratory tests, as you're saying, there are certain things we can do. We can do something called urinalysis. Patient will urinate, then we use a urine strip
Mhm.
to test the urine.
Mhm.
For proteins, especially when you see proteins, you know that there is a sign pointing to kidney disease.
Okay.
Yeah, for the proteins, we can check for glucose, sugar, because diabetes and hypertension they don't go well at all.
Yeah.
So they can complicate each other.
Okay.
So we can also do an ECG, that's an electrocardiogram. It's the
Okay.
where you have the electrodes put on the chest and everything to assess the heart. In that case, you'll be looking for target organ damages like left ventricular hypertrophy. That's what left ventricular hypertrophy is like, swelling of a ventricle of the heart, a part of the heart.
Okay.
That's just the meaning.
Okay.
On the left side, usually more on the left side like that.
Okay.
And also we have echocardiogram. It's more of like a machine that uses waves
Mhm.
to detect the function of the
Of the
heart. Yeah, the
heart,
injection
okay.
fraction certain parameters using that. Yes.
Okay, so while studying, because I actually have to, I'm not a medical doctor, so I have to, do a lot of little study. While studying, I came across the word pre-hypertension. What's that?
Okay, hypertension actually can be divided according to the JNC class 7 classification. You have normal blood pressure, you have pre-hypertension, you have stage 1 hypertension, then stage 2 hypertension.
Okay.
So that's how it's graded. That's how a doctor will assess the level and know when to act on you. So stage 1 normal blood pressure should be between 120 and 80. That's systolic. We know we have the systolic, which is up. Systolic is just a way to describe when the heart contracts.
Okay.
Then we have the diastolic when the heart relaxes.
Okay.
So systolic, it should be less than 120, while the diastolic, the one under, should be less than 80. So when you have pre-hypertension, it's now within the range of 120 to 139, and that's for the systolic. Then for the diastolic, between 80 and 89. Okay. Then it goes on like that for stage 1 hypertension, stage 2 hypertension.
Okay. Yeah. So now you're talking of stage 1, stage 2 hypertension. Where does secondary high blood pressure come in? Okay,
secondary hypertension. Secondary hypertension is just is a way of telling you the causes that we know, as I explained earlier on.
Okay.
The causes of hypertension that are known to man.
Okay.
I told you 95% of the causes of hypertension are primary. We don't know it. They're idiopathic.
Yeah.
That's what they call idiopathic in medicine.
Okay.
Whereas, for secondary hypertension, is hypertension that we know the cause. So once you can treat the primary cause, you're probably going to reduce the blood pressure well. Okay. But for the people that have primary hypertension, you don't know what to treat because you don't even know where it's coming from. It's very difficult like that.
Okay.
Yes.
All right, we'll go on a very short break, and when we come back, Let's Talk Health continues. Stay with us. Okay, welcome back. If you're just joining us, the program is Let's Talk Health, and I have here with me, we've been talking, Dr. Richard Ogbimi.
Yes.
So, Dr. Richard, what is isolated systolic high blood pressure?
Okay, then again, as I was explaining earlier on, classifications of hypertension can be divided into mild, moderate, severe, or normal pre-hypertension, stage 1 and stage 2 hypertension, depending on the organization describing it. We have the British and the American.
Okay.
Yes. So it goes. Classification of hypertension goes further to explain isolated systolic hypertension. As name implies, isolated. It's one on its own. Doesn't affect both.
Okay.
So isolated systolic hypertension is very, very common in the UK, especially.
Okay.
Yes, and it's when you have a systolic blood pressure very high, whereas the diastolic is normal or just mildly high. So you can have when you have like systolic blood pressure could be 160 as opposed to the normal of less than 120. Then the diastolic, that's the one below now, is going to be 80. So in that case now that's isolated systolic hypertension.
Okay.
Yes.
So now let's come to treatment options. What kind of treatment is recommended for those with hypertension?
Yeah. Okay. After a clinical diagnosis of hypertension, the management actually depends on the level of hypertension.
Okay.
However, according to the American Diabetic Association, American Heart Association, and American Stroke Association, I'm making reference to America because they are the ones that actually made most of these classifications and treatment. They recommend that lifestyle modification should be the first treatment for hypertension. So lifestyle modification now entails a lot. First is weight loss, as I explained earlier on. It has been shown that weight loss, if a patient should lose 10 kg, it's synonymous to reduction in blood pressure of about 5 to 20 millimeter mercury. So just imagine if you have a blood pressure of 160 now, systolic blood pressure of 160 now, it could actually reduce it just by weight loss. Could reduce it by 10 millimeter mercury, so it might reduce it to 150.
Okay.
That's without drugs.
Okay.
Yes, so that's one thing of it. We also have alcohol. People have to just limit the alcohol intake.
It's so difficult.
Yeah, it's very difficult. Because of the stress of the country and all that, so people tend to just go to relax and drink. The book does not say stop alcohol. They don't say that. Just except we obviously have a health condition, maybe a liver disease or something like that. You limit alcohol intake. For men, they usually say about 30 mils per day of ethanol. Then for women, about 15 meals per day of ethanol. So sometimes you have alternate days that the patient will not drink at all in any way. So it reduces the blood pressure significantly. Some people say there's some school of thoughts believe about 2 to 4 millimeter mercury. That's the level of reduction with respect to reduction of alcohol.
Okay.
And also diet, of course. Diet is very, very important.
That's very key.
Yes, with diet with respect to sodium intake.
Okay.
There's a molecule called sodium. Yes, and it's in the body. It's very essential for our lifestyle. However, ingestion of excessive sodium will directly increase the blood pressure.
Okay.
So we should avoid sodium about 2.4 grams of sodium a day. Should not exceed 2.4 grams a day. It's difficult to measure, but no Nigerian, maybe we just carry some women actually use like 3 spoons of salt for something small. If you want to take cocoa oats, they'll pour salt in it. If you want to take oatmeal or any of those,
women is not necessary.
Yes, they just put salt everywhere.
Okay.
So that's a few to talk about.
Okay.
Yes.
So now let's come to the numbers. For a layman, how would someone be able to interpret those numbers when you say it's 180 like that? How do you get to interpret?
Okay, so maybe you go to a hospital or a clinic or something like that, and the doctor checks your blood pressure without telling you. It's good for patients to actually ask the doctor first to explain. But if they don't even ask, they should have an idea. Or at least see the numbers. And seeing the numbers sometimes can be scary. Yes, but if the person is normal, there will be no problem. Okay. So a blood pressure, as I said earlier on, for the optimal blood pressure should be less than a systolic of less than 120 and a diastolic of less than 80. So once you see the blood pressure, if the one up is about 118, then the one down is 70, you should know you're very good.
Okay.
Yes, but then again, we have what we call hypotension. Hypo, that's low. No, the other one is hyper. You now have hypo. So hypotension is very dangerous as well too. So it doesn't mean because
it doesn't have to be high and doesn't have to be low. Is that hypo?
No, hypotension means very low blood pressure.
That's what I'm saying.
So some people might have
good if it's low.
No, it's not good.
Right.
So someone can pass out, can go into shock. Yes, and all that. So some people might have a blood pressure of 70, 50. That's dangerous.
Low.
Yes, it's dangerously low. Some people 50 and they might not even, there may be no diastolic.
Yeah.
So usually those people go into shock and an emergency actually. So the blood pressure should just be less than 120, but let's just say from 90, 70 to 120, 80.
Okay. So are there over-the-counter drugs that are recommended for those with hypertension?
There are drugs that are over the counter, but no drug should be recommended for any patient just like that to go and treat himself for hypertension. You need to see a doctor as a patient for proper evaluation, because the doctor will have to take a history, because those are the things that drive towards the diagnosis. Take a history, do a proper examination, and the examination also entails checking the blood pressure. So then the doctor will now determine whether the patient needs drugs or not. Okay. Yes. So it's not recommended. I don't recommend anybody to go to the chemist or a pharmacist and say I want drugs for my blood pressure. It's very dangerous and wrong.
Okay. Well, before we continue, I would love for us to do a little practical. I want to ask you, how do we get to check our blood pressure at home?
Okay.
We'll go on this very short break, and when we come back, we'll do a little practical on how you can get to check your blood pressure. To stay with us. Okay, welcome back. If you're just joining us, the program is Let's Talk Health, and we've been talking hypertension, otherwise known as high blood pressure, like the layman would say. Right about now, I want Dr. Richard to explain to us how we can do our high blood pressure check, blood pressure check at home, and he's going to do a little practical with me. So you just stay tuned. So, Dr. Richard, our viewers want to see how they can check their blood pressure at home. So you could just do a little practical with me so that they can see it, and probably tell them how to go about it at home if they don't have to go to the hospital to get to check it at the hospital. Okay.
In checking the blood pressure, it's actually called measuring of blood pressure. Okay. So you need a machine. You cannot check your blood pressure with your hands or something. You need a machine. And the machine, name of the machine is a sphygmomanometer. That's what it's called. Sphygmomanometer. Yes, yes. SP is actually a long spelling. So there are different types. We have the digital, and we have the mercury type, which is more of the analog. And when a doctor or a nurse needs to use the stethoscope, but this machine is the one that patients can actually use at home. You don't need to come to the hospital to check your blood pressure. You can actually use a sphig. So I'm going to demonstrate how to use it on
I'm excited.
the lovely lady here. Okay. Yeah, sit, don't cross your legs, just don't cross your legs.
Okay, I shouldn't cross my legs.
If you put your hand or arms in the wrong position, it might affect the blood pressure.
Okay.
Then one also has to get a proper sphig. For patients that are fatter or obese patients, they need to make sure the sphig is very, don't be mounted like this.
Okay.
This is the bladder. Yeah, not too tight, just adjust it. You need to relax because we have what we call the white coat hypertension. Once some patients see a doctor, their blood pressure rises.
Really?
Yeah, so you just relax your back.
Okay.
It's recommended that the sphig is at the level of the heart.
Okay.
Yes, especially when measuring. So just relax, relax your mind.
Relaxed.
Okay. So it's measuring. Just press the button, start button, then you have the measurement going on. Sometimes if you looking at the machine can make the blood pressure higher in some patients because you'll be nervous. Just
relax.
Take your mind off it.
Okay.
Yeah. You feel a compression.
Okay. Yeah, I actually did.
To calm down.
Yeah, it's calming down now.
So your blood pressure is done.
Okay.
Yeah. Do you want me to air it? Oh, no need. There's no need for that.
Yeah, actually.
Yeah, so that's it.
All right.
But it's fine. Blood pressure is fine.
Okay. Yes. I'm relieved. I'm relieved. Okay, thank you very much. So I bet you've seen how you can do that at home without having to go to the hospital first. So finally, lastly, Dr. Richard, your general advice to the viewers today. On what to do, what not to do, lifestyle, habits, and all of that.
Just like I've been saying since the beginning of the program, people need to really watch what they eat first. That's very, very important because it's almost like garbage in, garbage out. But this is garbage in and your blood pressure rises. So people need to watch their diet. If possible, see a dietitian to give them proper advice on what to eat and what not to eat. But to just say a few, avoid saturated fats.
Okay.
Yes, some people like oily things. We need to avoid such, and also reduce salt intake. Very, very important. Very, very, very important. Also, exercises, like I said, people need to, especially Nigerians, we are very bad with exercise. We don't do that at all. We hardly do that. It's very rare. If you tell somebody to go and register in the gym, they say, no, it's too stressful. I don't have that energy.
But even without registering at the gym, you can always do a
walk. People can take walks.
Yeah,
but
jog,
some people
skipping,
don't.
swimming.
Yeah, just anything that makes your body active is very important. It's recommended that people walk or actually do aerobic exercises for at least 30 minutes. Every day. Yes, minutes. Every day.
Okay.
So that's very important. 30 minutes every day. And also smoking should be stopped completely. There's nothing like reduction of smoking.
You just have
quit
to.
Smoking. Yes, because it's very dangerous. Then sedentary lifestyle as well.
Okay.
By sedentary lifestyle, some people might go to their offices and just sit down all day, get home, probably enter the lift, they don't even use the staircase, all those, that's sedentary lifestyle. So going to work does not make you an active person actually. It all depends on the kind of job you're doing.
You do, yeah.
Yes. So
oh, quite interesting session with Dr. Richard here. I bet you enjoyed it the way I did, and I actually learned a lot. Well, with that, we've come to a wrap of the interview segment. Thank you so much for coming.
Yeah, thank you for having me.
Yeah. And the show continues just right after now. Stay with us. And with that, we've come to a wrap of the show today. Don't forget to send in your comments and questions to the social media handles on your screen and an SMS to the number you can see on your screen. Like I always say, till I see you again, I remain Chinomso Amadi. Stay healthy, stay alive.